we can have the luxury of a doctor's office without the hassle of having to make time to go there.
Virtual doctor's office visits, a concept now gaining momentum within the medical community. But is it cost effective? And is it reliable? New tonight, 24-hour News 8's Sarah Hurwitz spent the day asking those questions, and she's here now with our story. Sarah?
Well, if you have a cold or a rash, but you can't go to the doctor's office, healthcare providers are making doctor's visits as easy as a video call on your cell phone or tablet. An approach that doctors and employee benefit firms agree will soon be the norm.
I want to start my video.
In less than 30 seconds and a few taps on the screen,
I'm able to connect to a Spectrum Health Medical Group provider.
A doctor at your fingertips, now answering questions and making a medical assessment of your condition, all in a live video chat. It's called MedNow, a Spectrum Health program, a virtual doctor's office visit for patients in a busy world.
We believe this is the future of healthcare. It's just another access point.
On-demand 24/7 care for things like coughs and colds, allergies or nausea. And doctors are able to prescribe you an antibiotic if needed. But is the program reliable without the in-person assessment?
There's not going to be the ability to physically touch someone, of course, being on two sides of a screen.
But as we video chatted with Dr. Christopher Brenner like you would, he says doctors can still make an accurate assessment with visuals of the throat, skin, and eyes, for example. But could someone abuse the system?
This is actually something that's been vetted out very well. We are using an electronic medical record.
In 3 years, people will be using telemedicine like nobody's business.
Bob Hughes with Advantage Benefits Group, which specifically works with organizations to design healthcare plans for its employees, says nearly 70% of healthcare organizations in West Michigan are signing on to the new technology.
They're going to diagnose and treat them right there, and that could be done anywhere, anytime, without this massive infrastructure that a typical healthcare provider needs. So the costs are dramatically lower.
And Hughes says that it's cost effective for both the patient and the healthcare provider because patients won't have to deal with the copays or large medical bills from visits, and healthcare providers will have to pay fewer employees instead of keeping an entire doctor's office open late. And the other benefit that I've been told is that for people who are traveling from very far away, they have hours to drive to the doctor's office. This is really helpful for them. They can just call, Skype right
Exactly.
in.
Right. Cost effective, it's convenient. It's not for every diagnosis.
Right, not for a 911 call.
Right.
Definitely.
But still, the logical progression of where technology is going.
How much better for parents, too, when you've got your little one, you know it's just a cold, you just need a doctor to just real quick
Right.
Yes.
Just give you a prescription.
take a look.
And this is 24/7, so I mean they can call it at any time.
Sarah Hurwitz. Thank you, Sarah.